To determine the proper size for your patient, we want to take two measurements. We want to take a measurement at the waist record that, and then we want to take a hip measurement right trochanter and record that. You can then determine the proper brace by our grid, which is located on our website. Once you have determined the proper size brace for your patient, it is time to apply it. You want to first start off with the posterior section to be just about at the top of the buttocks. Then once from there, this strap and the other strap are going to come around the front of the patient. Once the back is situated, the next thing you want to do is make sure that the anterior plate is midline to the front. Once you do that, you want to first attach the wide Velcro strap, and then you want to attach the other strap as well. Now at this point, either yourself or the patient will be able to tighten up the two front straps to make it snug. Once that's achieved, we have two elastic cinch straps, which I'm going to give to the patient, and it's got a little loop to it. They put their thumb in it, and they're going to just snug up the elastic strap and start to feel some support. Once the patient is fitted, make sure again that the brace is fitted properly, and then it is time to put the pneumatic air into it. And I'm using the squeeze bulb that we talked about before. Goes into the silicone connector. Make sure this is in a clockwise position, and you start pumping up the air and ask your patient once they start to feel it, which he does. And that is the total contact that we were talking about. And again, at this point, the patient has an option. You can either leave the bulb on if you decided to in any position because there's Velcro on the back of it, or if the patient does not like the bulb, just remove it and attach the strap. This is our second model of the Daytona Lumbar Pneumatic Orthosis, and this is the one with a single pulley system. So once you have determined your patient's size, and again, the sizing chart is on our grid on our website. This particular brace, unlike the other one, has 4 sizes. So you want to fit the patient. Again, make sure that the distal portion, the bottom portion, is right about the top of the buttocks. And then the brace is going to come around like so. Once you have correctly fitted the posterior section, it is now time to secure the anterior section. And just like in our other brace, you want to make sure that the anterior plate is midline in the front. You want to then take the strap, attach it, and secure it. Now, unlike the other brace that has the 2 elastic cinching straps, we have a single pulley system. Now, once the brace is secured to the patient with a single pulley system, the patient is now able, as you can see, to just fit a thumb in there and actually start to pull, and this whole brace comes in very, very neatly. The pulley system itself just stays on with Velcro. Now, in both braces, once the patient is fitted, 2 things. We recommend very, very strongly that the patient wears a t-shirt or some undergarment underneath the brace for obviously hygienic reasons. The other thing on both braces, once the brace is actually secured, and again, on this brace, just like the other one, we do have the little squeeze pump which will fit into that tube. And once the brace is secured and the patient feels comfortable, they can just remove one piece and the whole brace comes off in one complete section. So now, when the patient is ready to apply the brace again, the brace is already preset for them. As I mentioned before, on the anterior plates, they are pre-drilled with 4 holes. And the plate is going to, as I mentioned earlier, fit into this pocket. Once it does, you can attach any thoracic extension that is suitable for the holes being drilled. We like this thoracic extension because it has a lot of adjustability to it. And once this is fitted to the patient, there are 2 clips which will clip into place. And this is adjustable with an Allen wrench. This is actually designed for someone with either higher lumbar dysfunctions or thoracic dysfunctions, and it's very easy to apply. And once you do that, this is what the brace is going to look like posteriorly. What we have done here is we have added some slots right in over here, and this way you can loop the strap right into it. Before, many of these other braces have just Velcro tabs, and what happens is after a while the Velcro tabs will fly away somewhere. So our chief technician has added these slots into this, and we can just snug it up and these straps will not go anywhere. And I will say that both braces are proudly made in the USA. Thank you.